Hello and welcome to Nursing 313. We are going to go ahead and get started today with Chapter 1, Nursing in Today's Evolving Healthcare Environment. This loosely follows your textbook, the Black Professional Nursing, although I have added some content because some of the information in your book is a little bit out of date. There is a new edition coming out this year, but the pandemic's changed a few things. So um, I'll tell you when it becomes important for you to study the Google Slides as opposed to the book for purposes of taking your exam or completing assignments. But we'll start with a general discussion of what is nursing. Now, you've all taken Nursing 208, so you know that nursing is a profession founded to protect, promote, and improve health for all ages. There are many definitions of nursing, but that pretty much strikes at the heart of it. It comes from the American Nurses Association, which we will talk about extensively during this semester. It is both an art and a science, which attracts a lot of us. There is a certain amount of room for creativity and interpersonal relationship, but at the end of the day, it is based on the best available evidence when we're providing care. At its center is caring for other human beings using knowledge, judgment, skill, and compassion. It is a tall order, but the best of us are attracted to this profession for those very reasons. We want to use all of our talents. We represent the largest number of healthcare professionals. Out of approximately 9 million healthcare workers in the United States, over 4 million of us are licensed to practice nursing. And we'll talk during this semester about why this super large group of healthcare workers doesn't have a larger seat at the table. It's going to be one of the major themes that we come across. We're going to dig a little bit deeper into the profession of nursing and its many, many issues. But that's what nursing is and who we represent. Here's a little bit of demographic information about who we are and how we represent the population. About 4 million licensed RNs in 2016. 2018, the Nursing Workforce Dashboard puts the number at about 4.3 million licensed, but about 3.9 million practicing, somewhere in that range. And I can provide you with a link to the HRSA Nursing Workforce Dashboard if you want it. I don't think it's necessary, but the mean age of practicing nurses is 46.5 years of age, which means that as a profession, our average worker is fairly old. More than half of the people above that mean age are nearing retirement. So that has implications for the nursing workforce because we're not replacing them fast enough. We are predominantly female, 90%. That is maybe our biggest issue, that we don't attract enough men into this profession to really bring about the kind of equality that we need. And then in terms of ethnicity or race, 72% of us identify as white or non-Hispanic, white and non-Hispanic, as opposed to 63% of the general population in the United States. That means that ethnic minorities are underrepresented. Most of us, the majority of nurses are white, but the majority of our patients don't fit that same category the same way. About 11% of nurses identify as Hispanic. That is compared with 18.9% of the US. You can see that there's a big discrepancy there. And about 8% of practicing nurses identify as Black or African American, as opposed to 12.6% in the United States. That all has implications for disparities in healthcare, because if those races or ethnicities, if those groups of people aren't represented in healthcare, we aren't necessarily serving their interests. And we will talk about that throughout the semester. About 5% identify as Asian or non-Hispanic. These are much more recent figures. This number came from the 2018 survey that HRSA does on the nursing workforce. Your book has different numbers. I'll explain that in a minute. That is compared with 5.9% of the general population in the United States. So they're about equal, a little bit underrepresented. Your book says they are overrepresented. That is no longer true. They are using figures that are a little bit older from the 2010 census, United States Census, and from the 2014 survey. So that demographic has changed a little bit since your book was published, probably updated in the new edition. 3% of nurses identify as more than one race, as compared with 2.3% of the United States. And now here's where it gets really interesting. So Native American or Alaskan Native is a small, small percentage of even the general population. We're talking 0.7%. But the number of nurses, the actual nursing workforce survey lists it as 0%. I actually got a calculator out and did the math. It is not zero. There are Native American nurses, but the actual representation in nursing is 0.003%. Think about what that means for a population at risk for many, many health risks. We see it in diabetes, that their outcomes are much more poor. We see it in the COVID epidemic, or pandemic, rather, where the healthcare agencies weren't able to meet this disproportionate need for care. These people were at great risk, and they didn't have providers who could identify with them culturally, or avoid implicit bias. Most American Indians receive their care through the Indian Health Services, which is notorious for having issues with quality of care. So that's a little bit about our demographics and what they mean for us. And next, I'm going to talk a little bit about practice settings. This can also be found on the Nursing Workforce Dashboard. This is about where we work, what settings employ nurses. Hospitals are the primary, and I starred that for a reason. Learn to follow my stars. It will help you come exam day. Hospitals employ most of us. 63.2% of practicing nurses are employed by hospitals. These figures fluctuate, but not that much. Ambulatory care, which is doctor's offices, urgent care, outpatient settings like that, 10.5%. That also includes surgery centers. So that's a sizable number, but not that many. Public and community health, 7.8%. So it's fewer still. Home health, which could be lumped in with community health, really, but also small, 6.4%. Extended care facilities, and this includes psychiatric care, it includes long-term care for the elderly, it includes residential care for people with disabilities, 5.3%, and then other settings, and there's a number of them. People go into medi-spas, they go into entrepreneurship, and we'll talk a little bit more about that in the next presentation. That is 6.8%. And I'm pointing this out because America sort of has an issue with the way it provides care. We like to provide acute care that relies a lot on technology. It waits until people get sick to provide nursing services. There's a push, and there has been for the last 20 years, to get more nurses into the community, get more healthcare into the community, to keep people healthy enough that they don't ever enter the hospital. And that if they do enter the hospital, they don't come right back with the same thing. But we have not caught up to that yet. There is a great need for nurses in community. Now, that's a little bit about where we work. Pathway to RN licensure. How does a person become a nurse? Now, you may remember this from 208. I'm sure it was covered. But to obtain a license, a nurse must first graduate from an accredited school of nursing that prepares graduates for practice at the RN level. And there are all kinds of curriculum standards that go with that, things that the accrediting bodies think should be included in pre-licensure nursing education. And then you have to apply for the State Board of Nursing. They will review your transcript, make sure that you did graduate from an accredited school of nursing. They're going to have a criminal background. Some cases will be fingerprinting. There is a stipulation. I am mentioning this to you guys. You cannot be guilty of a crime of moral turpitude, and this includes things like DUIs or other substance-related offenses. And this goes back to the very, beginning of time. I have had graduates of nursing programs that I've worked for who've reached out to me and said, State Board will not grant me an ATT. I had a DUI 15 years ago when I was still in college for my first program, and now I'm applying for an ATT. It's no longer a part of my life, but they won't grant me an authorization to take the NCLEX. What do I do? And there's a whole procedure that a person would have to go through to prove that they are of decent moral character. And I mentioned this to you guys just to underscore the Board of Nursing, the state boards of nursing, are not there to advocate for our profession. They are there to protect the public from unsafe practice. And they sometimes get a little bit extreme with it. So it will be important to your future to make sure that if there's anything in your background that the nursing board might reject, that you start taking care of it right away. This graduate that I had several years ago had a DUI 15 years prior when he was still kind of young and in a fraternity. Um, and he had to actually get his pardon from the Pennsylvania governor before he was allowed to have his application processed. And that resulted in a 2-year delay from graduation of his initial licensure program to taking the NCLEX. And of course, he failed it because when you wait longer than a month or two, you start to forget things that you learned. And you're out of practice answering those NCLEX style questions. So keep that in mind. And then the third condition to getting an RN license in any state in the United States is to take and pass the NCLEX RN. I'm sure you've heard all kinds of stuff about that. It is a difficult exam. It's one of the reasons that we really emphasize test taking skills with you guys, even though we know the day after your exam, you're going to be in practice and it may not be super useful to you. The pathways to becoming a nurse in terms of education, there are 4 basic mechanisms, used to be 3, of pre-licensure nursing education, qualify to take the NCLEX. The first is the program you are enrolled in, which is a 4-year education program that grants a baccalaureate degree in the science of nursing, so BSN degree. That is considered sort of the gold standard. It's what we all aspire to. There aren't enough seats and there are plenty of barriers to 4-year education for some students. And there are other pathways. When we talk about the history of nursing, in a following presentation, I'm going to tell you why 2-year diploma school or associate degree programs became a thing and became very popular. They graduate the majority of new nurses. And then you can get a diploma in a diploma-based, usually affiliated with a hospital school of nursing. It generally takes about 3 years, and that includes your prereqs. Diploma schools used to be the primary method of educating people. It was sort of an apprenticeship program, and it was a free feeder pool for the hospital. It was like free labor. It still is used that way in some schools. But diploma schools are declining, and there's only a few of them left in the United States. And then lastly, this is a newer pathway into nursing entry, graduate entry program. So second degree BSN, also known as accelerated BSN programs for people who already have a baccalaureate degree and now want to go out and practice nursing. They don't want to have to start all over again as freshmen. So there is an accelerated program that graduates them in 12, 15, 18, sometimes 20 months. And then direct entry MSN, similar concept. The person has a baccalaureate degree in another specialty. They take the essential clinical courses for nursing, and they're eligible to sit. Everybody sits, whether they graduate from a 2-year, 3-year master's, to take the NCLEX and get that same registered nurse license. The difference with direct entry MSN is that they are also now master's prepared nurses, and they are equipped to take on expanded roles. All right, so that is the first chunk of content. I'm going to break it up and give you some questions that you might or might not see again, maybe a little bit different, but very similar. What is the primary work setting for registered nurses in the United States? A, home care, B, community, C, long-term care, and D, hospitals. Correct response is D. The majority of practicing nurses are employed by hospitals or hospital systems. Now that may change if the call for more nursing in the community ever becomes lucrative to the people who pay for it. We will have to see. Certainly it's a necessary change in mindset. Question number 2, what is true about the demographic makeup of practicing nurses in the United States? Select all that apply. I did not put in the United States for a test question. I'd be a little bit more picky. A, the nursing workforce is disproportionately female. B, nursing demographics have similar characteristics to the U.S. general population. C, people who self-identify as ethnic minorities are underrepresented in healthcare. D, nurses contribute the second highest number of healthcare professionals after physicians. Or E, the mean age of licensed nurses is about 46.5 years of age. Correct responses are A, C, and E. About 90% of nurses are female. Men are severely underrepresented in nursing, and it hurts us. We need to attract more bright, talented young men into this field, or older men, it doesn't matter. Ethnic minorities are underrepresented in nursing when compared to U.S. population statistics. We do not have the diversity in nursing that the whole country has, and that also hurts our patients in our profession. Nurses are the highest, not the second highest profession in healthcare. We have the most numbers. The mean age of the licensed nurse is 46.5. Many nurses nearing retirement age, and that has implications for you guys who are the future leaders in our profession. Question number 3. An individual is interested in becoming a nurse and has no prior college education. They have a high school diploma, maybe some training in something, but no college. Which educational programs will allow this person to enter the nursing profession? Select all that apply. A, an 18-month professional certification course. B, an associate degree program from a community college. C, a graduate entry program at a university. D, a diploma program offered through the local hospital. Or E, a traditional baccalaureate degree offered through a college. This is a good example of why it's important to read the question. 4 of these choices could get you to entry level, but only 3 of them are appropriate for this person. They are B, D, and E. A is incorrect. There's no 18-month certification course that will allow you to take the NCLEX and become an RN. You need to graduate from an accredited school of nursing. C is also incorrect. They cannot go into a direct entry MSN or accelerated BSN because they don't have a baccalaureate degree. These programs do allow entry to nursing for people who have a baccalaureate in some other discipline or specialty. B, D, and E are all options. You can go to a baccalaureate school through a local college that grants a BSN in nursing. You can go to an associate's degree program at your local community college, and you can graduate from a diploma school that is offered through a hospital. All 3 of those programs will allow a person without college experience to study to become a nurse, prepare for the NCLEX, and get a nursing license in any given state. We're going to take a break there, and that is a nursing classroom in contemporary nursing education. Looks like maternity. I see all the babies in the back.